to all the participants and Sir today's speaker, that is Professor and Dr. Nirav Rughani. I would be obliged to introduce today's session with the renowned physician and the professor, that's Dr. Nirav Rughani. He is a MD homeopath in the subject of organon of medicine, also a PhD scholar. He is a professor head of Department of Organon of Medicine and Philosophy and Fundamental of Philosophy and Psychology. Also, he is pursuing his PhD in Organon of Medicine, doing research on ADHD and LM scale potency from SGTU. He has also earned the SCR certification exam passed from the Institute of Clinical Research in 2016. Regarding his clinical work, he is a homeopathic consultant at Harmony Homeopathic Clinic at Surat since 2008. He is a professor in the subject of organon of medicine at Vidyadeep Homeopathic Medical College in Surat since 2019. Associate professor in subject of organon of medicine at CD Pachigar Homeopathic Medical College again in Surat. He has also attended a regular doctors group discussion session on clinical research cases once a week, handling a group discussion session with students and interns once a week. He has handled pediatric OPD at CD Pachigar Homeopathic Medical College, Surat for 6 years. Also, he is an approved staff in subject of organon of medicine at South Gujarat University since 2010. And also he has pursued taking the university exams in subject of organon of medicine at multiple times at Saurashtra University with great marks. Also, he worked as an RMO at Srimati Malini Kishore Sanghvi Homeopathic Hospital surgeon for a year. Not only that, there's endless work he has done. So next is that he also worked as a homeopathic consultant at various places like 21st Century Hospital, that is in Amisigar Clinic, Varta General Hospital, Shivam Clinic, Govind Prabha Arogya Sankul Charitable Trust, Dr. Shama Patel Clinic, Meeder Road, Mumbai. He has also worked as a RMO at BAPS Pramukh Swami Hospital, Adarjan, Surat, and had experience in casualty during night hours as well as worked in a ward and in ICU. He has also worked as an houseman for 3 years during his post-graduation study since 2005 to 2008. For 2 years, he worked at Dr. M. L. Thavle Homeopathic Hospital in Palghar in various departments like casualty, practice of medicine, rheumatology, skin and surgery under the guidance and supervision of different consultants. He has also worked at BMC Maternal and Child Care Hospital running by Dr. M. L. Thavle Trust in Dahisar, Mumbai, and took experience in gynecology, pediatrics, psychiatric, and general medicine under care of respective consultant and Dr. Dinesh Rao. Also, he has taken the training of ICR, that's Institute of Clinical Research, from Dr. Mihir Parekh at Baroda and from Dr. Hitesh Purohit, Sumeru Hospital, Karjan. He also worked as an RMO experience of hospital work from Kriti Hospital under guidance of Dr. R. B. Shah, BK Cinnamon Road, Mahesana during his undergraduation courses. He has always been so much dedicated to his profession. Also, he has worked as an examiner and conducted viva and had appointed as a paper setter at Gujarat University, Saurashtra University, and Veer Narman South Gujarat University since 2017. Also, he has presented clinical cases number of times in seminar and symposia. He also worked for a month of coastal side of Tamil Nadu during tsunami and given medical help to the affected people in January 2005. He also took part in rescuing team and worked for 6 days in an area of Bhuj during earthquake in 2001. Also, he is exploring the importance of remedy reaction in homeopathic management of acute diseases with the guidance of Dr. Sunil Kalinge and Dr. N.L. Tiwari and Dr. S.A. Katikari. Not only this, he has attended so many conferences, attended more than 35 symposia in span of last 15 years, participated in quiz contests of 10th Decimal Celebration National Conferences in Bangalore in 2003. He also attended the National Conference in Gandhinagar, then Mother and Child Care 16th International Conference in Goa, took part in different workshop of homeopathic medicine education technology module that's at CCH Delhi, attended CME in the subject of pulmonary disease and homeopathic management and Palghar, attended teacher orientation program of postgraduate teachers in subject of in subject of materia medica at Palghar, attended CME on thyroid disorder at Garjan sponsored by CCH for practitioner, participated in teachers workshop for second year BHML syllabus discussion for subject of organon of medicine, and attended college seminars organized every year on 6th of October with different speakers like Dr. Subha Singh, Dr. L.M. Khan, Dr. Vispara Parthsarathi, Dr. S.M. Singh, and many more by Dr. C.D. Pachikar Homeopathic Medical College in Surat. He has also attended the third National Conference on Recent Trend in Science at NobCon, Junagadh, and Reverend Dr. Henneman at Sri Govind Guru University. Like this, he has attended a multiple seminars and attended, not only attended, he has also participated and presented his viewpoints also. Also, he has reference to Dr. Hahnemann Clinical Practice and Research at Sri Govind Guru University. Articles and presentations which he presented that are presented a case of vitiligo at Mumbai Symposia, article on homeopathy and genetic disorder at NJH, cases at Baroda Symposia and at Mumbai Symposia number of times. He also presented evidence-based pathology cases on Being Homeopath seminar on 28th of August 2017. He published an article on molluscum contagiosum in a mannish aggressive ghoul in National Journal of Homeopathy, which issued in the November of 2019. He also published a case-based article on glossy, shiny, precious metal, a unique girl at NJH in April 2021 issue Roll 6 periodic table. Research paper presented in third National Conference, NOPCON, recent trend in science on 22nd of October. Also, he has published an article at NJH Ability Homeopathic Observation. He also submitted the ICR way of attended National Homeopathic Symposia on exploring homeopathic management and strategies of allergic skin diseases. Also attended national level symposia on mind and material medical psychological dimension in clinical practice at Mumbai. Also taken online seminars on role of immunity in COVID time for the students of CK Patiwala College of Engineering and Technology. I'm amazed by all of your work, sir. I'm so much obliged to hear with you for this today's seminar regarding topic is learning from the cases. So can you hear me?
Yes, yes. We'll hand out the session to the sir. Session is all yours, sir. We welcome you, sir.
Thank you, Dr. Lavanya, for elaborative description about the resume of biodata. Warm welcome and good evening to everyone. Is the screen is visible now?
Yes, sir.
Okay. Basically, we as a clinician always learn from the practice. So I did not give any specific topic for this webinar, and I just randomly given a few cases which just came into my mind. The recent cases are this: a case of a young boy, 4-month old. Basically, the mother of this child is a homeopath and father is a veterinary doctor. They had come with this boy, 4-month old, with the complaint of dryness of the skin of at whole body. Whole body was dry, rough, and there is a redness and multiple small tiny clusters. There are certain way of scaling at a few junctures, but the major problem is about the dryness. So it was a purely looking at the dry skin lesions, and we have to evaluate the skin disease of a origin where the newborn is or the early age onset of the dryness. This picture was taken later on when the other part of the skin was healed and the new spot was developed. I did not get the chance to take the initial picture of the whole body dryness. So it was a purely case of the ichthyosis, and the, uh, the clinical aspect was clear from the beginning. And since 4-month-old child, we have to take the history of the mother and the few characteristics of the child. So mother said that the child is very quiet and calm. The child did not trouble his mother for upbringing. The child likes open air, and specifically kind of any air, not only open air, but the child wants fan. The general aspect about the dryness of the skin and the discoloration of the skin. And this boy is very sensitive to the woolen clothes. If any kind of clothes mother used to wear this child, the child get a rashes. And mother's state during pregnancy was fearful, timid, and anxious. Child was prescribed calcare carb. Initially was in 30, then 13 frequent repetition, almost daily repetition, then 201 packet, and then it was shifted to 0/1, 0/1 daily repetition. With this, the constitutional aspect of remedy, the child was not improved as we expected. Then the air desire was understood in a way of thermal state of a hot, and then prescribed the sulfur 0/1 in a daily repetition. And it helped a lot. So we had prescribed almost sulfur 0/1 daily repetition for 1.5 months, and whole dryness was disappeared. Then sulfur 0/2 was prescribed for a week, and then child was completely better. The mother said that the child had never perspired, but now his head has a little perspiration, and the skin is little now smooth rather than dry. And then the child was off the medication for some time, and then new picture came. The child has a distinct craving for tomato and sour thing, and the quiet and calm child is now active and irritable. The active and irritable in a sense that the child used to hit his hand, and he wants the mother or father should carry him. So at that time we had prescribed phosphorus 200, and with that the child was again completely better, and the case was resolved. So from this case, I have learned that the remedy which we had selected as a constitutional calcare carb gave the opportunity of this child to prescribe sulfur later on, and the use of 50 millisiemens scale and in a frequent repetition. The another case of a child, 10-month-old boy, the parents had come with the complaint that this 10-month-old boy had a complaint of lesion on his face and extremities. And it was started when he was just 3 months old. Initially, it was on a left cheek, then on the right arm, and then bilateral legs and buttock area. The complaint started with the initially eruption and watery discharge, and then it turned to the ring form lesion. There is no itching, no bleeding, no scaling. This boy was very these are the lesion. You can see at the face, the left side and the right side, both the side, there is a ring form of lesion, erythemas, and dryness at the outer ring area. These are the lesion on the leg. So it was diagnosed as a discoid eczema. This lesion was definitely distinct in a way of syphilitic eruption. This child is very hyper. The mother is now fed up with this child. The first child, mother said that she has to get busy with this child because he wants some or other activity, and he's very mischievous in a way that whatever he want anyhow. No one can take anything from his hand, and he doesn't go with the other stranger persons. So he has a little fear of strangers. I prescribe the Merck salt from looking at the lesion and the hyperactivityness and the obstinacy. And surprisingly, the Merck salt 30 3 powder weekly helped this child, and child is better with this completely. This improvement was just in a few weeks only. The whole lesion disappeared. You can see that lesion on the leg, which was and now. Another case of a male 40-year-old. This male was actually coming for the complaint of sinusitis initially. And he was better with the pulsatilla and calibicomicum. On and off. Sometimes it gives the pulsatilla picture because of thirstlessness. Sometimes there is extreme sensitivity to draft. It was prescribed calibicomicum. And with this both the remedy in a different pictures and different time, this patient was much better in his sinusitis. And we had prescribed Kelkarab as a constitution for him. During the course of the sinusitis treatment, he had developed this lesion. And he did not mention that he has developed this lesion. But after 1.5 years, once he came and he said that he is suffering with the dry lesion at his hand, and it is itching now. You can see the lesion on the right hand dorso. There is a third and fourth finger, ring and middle finger, and the right foot. There is a definite eczematous lesion. The only comment is about the itching, and it was aggravated at night. There are other 2 lesions at the bilateral elbow, and these lesions are hard lesions. There is a hardness of skin, sometimes few exfoliated, and sometimes there is only blackness. But there is no oozing, no bleeding, only dry lesion. There is a dry eczema. This patient was prescribed Kelkarab. Initially, it was on the 201 m when he used to came for sinusitis. But when we prescribed this man with the Kelkarab 10 m weekly dose, he was better with that, and these lesions disappear. We can see that bilateral elbow, the dry, scaly zygotic lesion now completely better with the normal skin, even in the right hand and right feet. Another case, beautiful case of a lady, 55-old female. She is coming from a village area, and when she had came with her whole family came. It was like a lady with whole group of the people came in the clinic. What was the complaint? The complaint is about the itching, scaling, discoloration, redness and burning at the skin lesion on bilateral legs, elbow, eyes, chest, abdomen and buttock. And it was since 2 years they had taken the treatment at a local level and even from the dermatologist, but it was better for a while and then it again reappeared, and this lady was fed up with this treatment. So they had any kind of treatment which they wanted, like it should go permanently. This lady is a known case of diabetes, and the sugar level is not under control, was always remaining around 300. HbA1c is also 11. Hypertension and hyperuricemia. We can see the lesion, discriminating type of lesion at the bilateral legs, extremely red, blotchy, scaling, thick scaling. On the eyes also, bilateral ears, chest, back. These are the lesions on the back. From the photograph, it is clearly evidence that these are the lesion of psoriasis. Now, surprisingly, we had prescribed this lady initially with the opium, and with the opium 33 packet, whole lesion disappeared just in a week. Just in a week. We had not taken this case, but we had just prescribed from the lesion and the way they had approached. Like a bossism, she was like a lady dawn. The way she had came and sit, the way she had approached, and there is another concomitant complaint about the sleeplessness and constipation. So initially I had prescribed opium, and with the opium 33 powder, the skin lesion better 50%, more than 50%. And then we had defined the case. But psoriasis is known to be always reappears within a short period of time. So it reappeared in a month. And after that it reappeared, we had prescribed as a remedy, constitutional remedy, lachesis. The lachesis prescription was based on her constitutional way, like she is always in an angry, irritable stage. She is very dominating. She said that if my maid doesn't come, I go to her house, I snatch her neck and take her to my home. She used to support the people, but if people doesn't give back, she can slap anyone. She has a 4 daughter. One of her daughter is now come back and stay with her because of the marital issues. And this lady has slapped the man who had married with her daughter. So initially we had thought that it is purely lachesis. We had prescribed lachesis 200, 1 packet to 3 packet, and then even given 1 m. But it did not help what we had expected. So we had prescribed sulfur by understanding the local lesion and the modality. So initially sulfur 201 packet and then given 3 packet, and with that she had improved. The skin lesion is now much better, and it better for a period of time, not for like a opium state. which we had prescribed, and it disappeared for just a week. But the improvement in this time lasted for almost 6-7 months. The whole lesion on the back disappeared. The eye lesion is now better, much. The leg lesion is much better. So another case, the last case, the case 5. She's an old patient of mine. When I had started my practice way back in 2008-9. Initially, when she had came for the complaint of the bilateral fit eczema, and it was much better. It was very hard, thick skin with redness at the border. But she was prescribed a remedy, and she was much better. So she was off treatment for almost 10 to 12 years. And there is no recurrence of that kind of skin complaint. But she had a rheumatoid arthritis, and this is also under control, and there is no active joint involvement in last couple of years. Recently, she had came with the complaint of itching and eruption. It is the history of just last 20 days. And the itching with exfoliation of the skin. She had given a history that initially she had a fever on the first day. And it was like a vesicular eruption. It started from the back and then on bilateral extremities. And with that skin complaint, there is a concomitant complaint of the left thumb swelling and redness and left hand stiffness. They had consulted 2 dermatologists and 1 local doctor. All of them have diagnosed that it is a chickenpox. So they had initially taken the treatment of a chickenpox. So lesion was little decreased, but it did not disappear. And it again reappeared with the form of itching and exfoliation. But now, presently, there is no vesicles when she had approached. So initially, when I have examined this lady, this lesion are like this. The back and hand. There are also on the leg similar kind of lesions. So 2 dermatologists said that it is a chickenpox. Now it is how can we claim that it is not a chickenpox? As a homeopath, we have to understand the skin lesion and diagnose from the skin lesion rather than rely on the opinion of the other doctors. So looking at this lesion, it is definitely look like a psoriatic lesion. So we have diagnosed that it is a psoriasis, it is not a chickenpox. And we have prescribed pulsatilla by understanding the old prescription which we had given a couple of years back, because that remedy had helped her. So this time also with the pulsatilla 203 packet weekly, this whole lesion disappeared. We can see that on the back and bilateral arms, whole lesion disappeared, and now she is off the treatment. The pulsatilla was prescribed by understanding of the old prescription, the old communication with this lady. This lady was like, she had put me in a state of like her brother. Even when I had opened my clinic, she had came and presented a few gifts to me as a brother. She is so much sensitive and sentimental lady, but in a lamenting way of her expressions. Like always crying and lamenting and putting her complaints in a way that one should feel pity on her. So it is actual pulsatilla. So the pulsatilla has helped. So these are the few cases which I just came into my mind and I presented this. Thank you very much. Is it okay now? Or you want another kind of few more cases or a few more presentations?
Sir, am I audible, sir? Hello.
Any kind of doubt or questions?
Yes, sir. In case 1, why can't we go with Sina and Chamomilla, sir? This is the question, sir.
Okay. The case 1.
Yes, sir.
Case 1 was a ichthyosis case. That child was initially very calm and quiet. And that is why we had prescribed the calcarea carb. But with the understanding of the only thermal state of hot, we had changed to the sulfur, and sulfur 0/1 has helped. So I did not thought about any kind of remedy which is very irritable. The Sina and Chamomilla both are very irritable in nature. Any other question?
Sir, there is
Yes.
another question, sir.
Hmm.
Sir, do you use any repertories or just your medicine knowledge? Which repertories will be more useful in the initial day of practice? This is the question, sir.
Good. I use the software Homeopathy, and I have a habit to put down the characteristic symptoms first into the repertory, and it gives me a sum of the brief idea that what kind of group of remedy it shows. And from that, sometimes it helps me that I should prescribe from this, and sometimes the clinical pictures always give evidences that you should prescribe this rather than rely on the only repertorization, because repertory is a kind of a bridge between our understanding of organon philosophy and the materia medica final prescriptions, because we have to rely on the final prescription about the materia medica, and how to find the final remedy. The repertory helps us sometimes. Okay, I saw the another questions. How to take a mental symptoms from the pediatric cases? Okay, from Dr. Pranav. Yeah. In a pediatric cases, majority times we have to rely on the hard fact rather than subjective symptoms. We have to give more importance to the objective symptoms. From objective symptoms, we can understand certain mental aspect. So I can take an example like this child of Divam, the discard eczematis. This child was irritable, I have considered. Why? And obstinate, I have considered. Why? Because I have a habit to play with the child to understand his nature. So I give him something and then I take from his hand. But he doesn't give back. And he gets very obstinate and angry. Some children, when we approach them, like a first case, the ectasis. Whenever initially when we had prescribed him calcarea carb, I used to examine him and he allowed me to examine. But when the symptoms change and now he is like a phosphorus and he was initially better with the sulfur, now in a state that when I approach him, he starts crying. When I look at him, he starts crying. So these are the certain characteristic observations which we understand in a pediatric cases. In pediatric cases, we have to rely on the mother's observation also, because mother gives a history that my child behaves in a such way. So the behavioral aspect also gives certain mental qualities. Yes, there is another question. How can we accurately diagnose skin condition? It is actually through multiple times of observation and practice. If you want to understand the skin disease and diagnose it, you have to sit in the dermatology OPD for a period of time. You have to see the number and varieties of cases, and then you will able to diagnose it. Because it is not like you just read the book or look at the picture and diagnose. Because sometimes morphology is also important, sometimes clinical history is also important, and sometimes the actual evolution is more important. Because if we see the last case, the dermatology has given diagnosis as a chicken pox. Maybe that at that time it was a chicken pox, but when that patient came to me, I did not see any kind of chicken pox lesion, no vesicles. It may happen that patient was suffered with the chicken pox, and chicken pox has a flared up this skin lesion, because this lady is a known case of a rheumatoid arthritis, and now she developed the psoriasis. So it was a connection, psoriasis in a case of rheumatism, and the specific lesion with which we had find out. Any book do you recommend for it? The For skin condition, the Valia textbook of dermatology is recommended, because it gives a fair amount of understanding about the evolution of the disease, morphology, the clinical pictures, and the photographs of evidences. In cases of skin disease, can we prescribe external applications? Sometime when the patient has a complaint of severe itching or dryness, we used to advise them to take a plenty of water or use moisturizer in a form of the either coconut water or Vaseline. But I usually don't prescribe any kind of external application which is a homeopathic or any kind of medications. The reason behind it, because it changed our pictures and deviate it. So we cannot rely on our internal remedies, because actually the internal disease are being treated with the internal remedies. If we prescribe the external applications, sometimes it helps at a local level, but as a conceptual level, at organon level, the miasm and the internal diseases still remain. Yes, anything else now? Any other questions?
Uh, Sir, I would like to ask you one question. Am I audible to everyone?
Yes, ma'am. Yes.
Thank you, sir. Sir, in the case of cellulitis, when the lesion is quite big and the skin connection is not proper, so in that case, as you mentioned that you do not recommend any external application, but I've seen the patient who are, instead of using the sulfuric acid to keep that area clean, they are using the calendula. So is that okay? Will that heal a little bit? Because I've heard from the patient's mouth itself that they did tried it and it worked actually.
Madam, are you talking about the cellulitis cases or specific cases or in general aspect?
Cellulitis cases using the calendula application when the wound is quite bigger.
Yeah. We prescribe that calendula or acid force in a wound healing, because it definitely promotes the healthy granulations. Uh, yes, it helps at a local level for if it is an external wound. So there is a concept. The disease is being produced because of the external aspect or because of the internal disease. And sometimes internal disease uh, produces a certain external expression, and when we want to treat that external expression, we take help of the external applications. But the external application is not the only and final result. It helps at a certain level. But when we want to treat the disease, we have to prescribe internally. You are right. Recently, I just, because when you are talking about this external application, I recently case of a girl, young girl. She has a multiple fissures, perianal and bilateral axilla, and in that case, because of there is an open wound, she had done the surgery, and because of that open wound and it did not heal since last 3 months, we had prescribed him to use the calendula mother tincture as a dressing level. But calendula helps to just close the wound. It will not help to resolve her complaint of recurrent fistula. So when we want to treat the fistula, we have to give an internal remedy.
Thank you, sir. So there is a question: will use of the same ointment of the medicine being given internally change the action of treatment in any good or bad way?
I did not understand. Can you repeat?
Question is, will use of the same ointment of the medicine been given internally?
Okay,
So
I
she's
can read
trying
that.
to ask,
Okay.
yeah,
Will use of the same ointment of the medicine being given internally change the action of the treatment in any good or bad way? To be frank, I have never used the external ointment of the remedy which you have prescribed internally. Example, if I prescribe calcarea carb, so how can I prescribe calcarea carb as an ointment? So I have never experienced it. So another question is, any specific treatment method or medicine for very high IgE more than 880? Will symptomatic or constitutional prescription take care or anything else to do so? IgE is definitely allergic origin, and I have a case of a lady. She has a complaint of runny nose and sneezing. She's an engineer and professor in a college, and her IgE is more than 5,400. 5,400. Actual IgE level is less than 150. In that case, we have to be rely on the constitutional remedy, because it is a purely the sensitivity of that constitution is responding this complaint. In that case, if we use certain specific remedy, a certain local acting remedy, it doesn't help for a longer period of time. It helps only for just few days or a week, then it again reappears. Same medicine, external and internal. I just said that na, if I prescribe calcarea carb internally, how can I prescribe the external? And if you said that the calendula which I have prescribed externally for closing the wound, I don't think that calendula will help to heal the whole gamut of fistula, which is at the perianal area and the bilateral axilla. Anything else
Any
now?
other questions, participants? If you have any questions, please put it in the chat box. So can you please also put a light on if there is any case related to burn, like in cases of children when it's a burn, like the hot water has been poured off. So anything which can help homeopathically, not just internally but also externally to relieve the pain.
Till now, I have come across with the three cases of burn. Uh, in that all, the constitutional had helped, but yes, for the external dressing level, we have used the calendula, and in a severe degree burn, we have also take help of the silver X in a medical hospital. But yeah, constitutional remedy had actually healed the whole burn area.
Please, sir. And the mother tincture of calendar should be directly used, or will it be diluted with, like using the distilled water and then mix it and then apply it, or directly we can use it the calendula mother tincture for dressing?
No, basically we have to dilute it, otherwise patient will shout because of the extremely burning way of complaint. The whole mother tincture, the every mother tincture is alcohol, and if you put the alcohol on the open skin, it will really burn a lot. So it is advisable to dilute it and use it. In a few juncture, we had also used the mother tincture directly on the wound. When we want the healthy granulation at a fast level. Sometimes if the wound have a slough, we have removed it, but still there is no granulation, we use the mother tincture undiluted, because the strong mother tincture will excite the tissue, and it help for the healthy granulations.
Thank you, sir. Thank you so much for answering all these questions. Um, Lavanya ma'am, over to you.
Sir, there is a question from the participant, sir. If water comes in contact with wound, then changes of pus formation will be more. Then does dilution do cause such problem? This is the question, sir.
Water comes in contact with the wound, then changes of the pus formation will be more. Then does dilution do cause such problem? Uh, when we dilute with the water, actually there is no only water. There is also alcohol. So when you dilute and use it, the water will not remain there. We are just cleaning it. And when we want to use as a mop, we should not dilute it. Because when we take the tincture and use on the mop, it is dry mop. It is not completely moist and wet. It is just a dry way of using it. So at that point, there is no water if we have to put it and then the cover it. But when we want to clean it, we can dilute it. And sometimes if we want to clean it like a slough area or pus formation, we use the concentrated also. Any other question now?
I don't see any question in the chat box, sir. So can we be able to get the link for your uh, discussion group, as you mentioned that you take a discussion for the students and interns? That will be helpful, sir.
Basically, it is a offline. There is no online. Uh, we meet on every Tuesday afternoon 2 to 4.
Okay. Thank you, sir.
We had also online sessions by ML Dawlat Trust from Malad. They are just relaying from that, and from whole India, the participant can join and attend that live sessions, discussion sessions. But it is on Wednesday, uh, 2 to 4.
Oh, Lavanya, ma'am.
Yes, yes. Hi. Thank you, sir. Thank you so much for enlightening us with the wonderful session. It's quite
There is a question,
overwhelming
ma'am.
to have you. Okay, kindly continue. Yeah.
Thank you.
How to register that session for the Malad MLW? Question from participant.
You can contact that trust. Basically, it was started 2 months back, and it was for a 1 year course. And every Wednesday they relay from that Malad, and every time there is a different cases by the different faculty. I will try that if they reactivate the link, because it was closed before Diwali. It was a paid webinar, 5,000 rupees for 1 year, and every Wednesday. I am also a participant in that group. It was not created by me. It is like from the institute that they have created. If anyone from you want to actually attend it, then you can contact me. I will try to contact them and request them to reactivate for you.
Thank you, sir.
Thank you, sir. Thank you so much. Over to you, Manali.
Evening, everyone. I am thrilled to inform that AHSA, All India Homeopathic Students and Youth Association, is going to conduct an extraordinary event, that is International Ayush Conference and Ayush Youth Festival 2025, scheduled on 12th January 2025 at Salt Lake, Kolkata, West Bengal. Many other activities like Global Youth Summit, Ayush Literacy Conclave, Arogya Fair, along with some exciting competitions like e-posters, article writing and drawing, etc. will also be organized over there. For more details and registration, you can get link of the conference from our YouTube description box and webinar chat box also. So don't miss out and save the date now. Thank you for your kind listening. Over to you, ma'am.
Respected participants and everyone, there are the links which pertaining to the Asia International Conference given in the chat box. Kindly check it out. And thank you, Thank you, sir. Thank you so much for enlightening us with a wonderful session. We hope for the many. And thank you all the participants for the active participation. Thank you, Timaisha, for the wonderful sessions. And thank you to our media partner, Homeo 360 Degrees, for supporting. And thank you all. We'll be back soon with the another session by tomorrow at 8:30. So stay tuned.
I would
Thank you.
also like to thank the Bijain and the Dr. Pranav Shah, who had given me an opportunity to connect with you all, and the whole team which you are taking the effort of organizing it. Thank you very much for giving me opportunity. Thank you.
Thank you, sir. Thank you so much. Thank you, everyone. We'll be back soon with the tomorrow session. Thank you all. Good night.
Good night.